crisis intervention response team, of course, that partners a licensed mental health therapist with crisis experience with an HCSO deputy, and they ride out in the field together taking mental health crisis calls.
So HPD began the C.I.R.T program about 13 years ago, and it really is the foundational program for the mental health division. There have been several instances where we were checking by with the mobile crisis outreach team, or they were calling us for assistance, or we needed them to help out with an individual. So it just seemed a natural fit to create this program where we put the clinicians in the vehicles with the police officers.
We didn't actually have enough C.I.R.T teams to take all the calls in Harris County. So another program was invented, the Clinician Officer Remote Evaluation Program, and it's the same concept, but now the clinicians have iPads, and so more deputies now have access to clinicians.
I spent almost 7 years in the crisis intervention response team, probably one of the best units I've ever been involved in, and out of that unit was born the Clinician Officer Remote Evaluation Program. When I was in C.I.R.T, Harris County Sheriff's Office being the umbrella law enforcement agency over Harris County, we responded to almost just about all calls for service that came through our dispatch, even other jurisdictions that needed a crisis intervention response team unit. A lot of the times we were spending anywhere between 30 minutes to an hour going to a call. And what that meant was that deputy or that police officer was waiting for one of our C.I.R.T teams to arrive to assist in determining what to do with this individual.
Our C.O.R.E telehealth program is the only way to provide quick, affordable access to behavioral health clinicians on a wide scale. So with C.O.R.E or similar telehealth programs, you are providing police officers availability or connectivity with a master's level clinician, where without the technology they just wouldn't have that availability. So again, it's a force multiplier. Through technology, you're providing this access to behavioral health professionals that otherwise didn't exist.
Being able to have 150 iPads deployed through our 5 districts and leaving C.I.R.T to the more critical calls is amazing. We're able to not only leave C.I.R.T to the more critical calls, but also assist a consumer who needs that mental health resource right there and then, in real time. Being able to deploy that tablet, get them connected to services, and then leave them on scene is great.
The mayor has asked us to put together a program. We're in the process of building it at this time, and we hope to have it ready by October, ready to roll out to where Houston Police Department will have 80 iPads. We plan to distribute those iPads across all the patrol stations, and our goal is to have those iPads available all 3 shifts, 24 hours a day, 7 days a week. So that all officers on patrol have access to a clinician. We think it's a great extension of the C.I.R.T program without having necessarily have that clinician on scene, but it's the next best thing. And we're very excited to start having the C.O.R.E program in the Houston Police Department.
The Houston Police Department, Harris County Sheriff's Office, law enforcement in Harris County, we're very, very fortunate to have the Harris Center. The collaboration we have, I truly think, is a model. Again, we can't do this on our own. We're not behavioral health professionals. And again, we're just very, very fortunate here in Harris County to have a very strong working relationship.